Good afternoon, all. Any apologies for absence, please?
Thank you, Chair. Yeah, apologies this afternoon from Councillor Kerry Evans. Do we have any others?
Yeah, Dave House is on leave
Oh,
this
yeah,
week,
Dave.
and Jane Whitmore as well.
Okay, thanks.
Item 2, disclosures of personal and prejudicial interests. No. Item 3 is the minutes. To approve the minutes. Right, okay. Monday, the 7th of April, the first set is page 1. Page 2. What do I am now? Upside down. Yeah, I'm upside down. Hang on. I got another one here out. My print out this. Right. Sorry, guys. And page 3. We have a mover, please, for that set of minutes. Myra.
I move, Chair.
Okay. Vote. Can we have a vote, please, to approve the minutes? Yep, thank you. And then the second set of minutes, Thursday, 15th of May, page 4. Page 4. Can we have a mover, please? And a seconder, please. Can we vote to approve the minutes, please? Fine, thank you. Item 4 is the terms of reference for information only. And then we go on to item 5, which is the work plan discussion for 25-26. Right, so we have, excuse me, adult services, early help model, to link with enabling communities, volunteering strategy, community mapping, etc., and day services. Is that okay?
Yes, Chair, that's absolutely fine. We'd be happy to bring reports forward for that.
So shall we talk through the items first and then slot them in? Is that easier for you?
Yeah, I suppose it depends when the officers can
Yeah.
bring the reports to committee. So I don't know whether you want to have that discussion now or whether you want to do that outside the meeting and bring it back.
Happy to do it as we go along, or also we might find it once we get to the end of the list. Perhaps there might be a natural order of it, maybe.
Okay, thank you. Then we have child and family services, transition with a focus on promoting independence for vulnerable young adults, when I'm ready, and foster carer support. Is that okay, Julie?
Yeah, and the transition will be joint with adult services colleagues. So, yeah.
Thank you. Yeah.
Can I suggest a joint one if at all possible? Sorry, it wasn't on this list, but it's come up more recently because the Strategic Transformation Committee, another joint piece of work between Child and Family and Adult Services is around our direct payment policy. So it's a bit of work that's progressed just in terms of the information we give the public around direct payments. We thought it would be something that as a committee you might be interested in seeing at some point this year as well.
Yeah. You okay with that, Liv? Yeah. Thank you. Yeah. And then we have enabling communities, volunteering policy, Cuchmawr forward planning, early years childcare expansion, digital inclusion, tackling poverty strategy, substance misuse recommendations of the Drugs Commission. Al?
Hello.
Are you okay with that?
Yeah.
Yeah, and-
All on board.
I don't know which officer would lead.
It will be Jane Whitmore's
Yeah,
team will be
Jane,
bringing
yeah,
that
right,
forward.
thank you.
So yeah.
Thank you. Right then, is there any, the dates we've got set up are,
Hang on, Alan, Jeffrey's got his hand.
oh, Alan, let's come in. Alan, you're
Can
on
you,
mute. You're on mute.
How's that?
There we are. Thank you.
Yeah, just to revisit that point about drug taking and regarding vulnerable people. I've read the agenda item 4 on our social care and tackling poverty. And the bullet point states, that safeguarding people from harm, but I feel we need to save people from harm with regard to substance and alcohol abuse. And I think that should be tackled, bearing in mind that, the problems that we got in the city centre. And I refer to I think I might have said this before, but, prior to the pandemic, I helped support a drop-in centre for people that were lonely, sort of vulnerable and struggling with addiction at the Brunswick Church at St. Helens Road. We provided a warm place with an evening, over an evening meal and a warm place where they could, well, basically they're off the streets and they have an opportunity to chat with or about their problems, play cards, pool and so forth. They did all those kinds of things. It was a period from 6 to 9 that kept these guys and women off the streets. It tended to settle them down. And when they left the place, then they were ready then to sort of go home, rather than to, as the public would say, cause havoc throughout the city. We've got, there's lots of abusers, I should say, wandering the streets in Swansea, but I feel they've got nowhere really to go. I know there's Matt's Cafe at the top of High Street, but I see in the centre of town or somewhere near, there's just nowhere for them to go. And I feel that drop-in centres should be, I think we should focus a little bit more on having drop-in centres. There's somewhere where they can go to address their drug addiction problems. And if I refer back to the Brunswick Centre that we had there, when they came in, my wife was a nurse and she would chat with especially the women and see to the lesions that they had on their legs, which is all due to drug abuse. And, they could have a haircut, they could have a wash. We did those kinds of things, but I can't see anything like that in the city centre at the moment. And I feel it's something that we should really try to address. I hope I made my point clear in some way there, but thanks, Chair, for that.
Thank you, Alan. Anyone wishing to
Yeah.
respond?
Can I
Hiya,
come
Al.
in, Mandy? Can I come in, Chair?
Yes, Al.
Yeah, only
Yeah.
just to answer Alan, just to say that this report is the findings of the Drugs Commission that I've been involved with for the last sort of year, 18 months. It's been doing a review of all the services offered in Swansea and the sort of the good and the not so good or what's not working. So the whole idea is that by the time we look at this, they will have published their report and everything, and we'll be able to go through the recommendations. Just to reassure both Barod and Devodal have drop-in sessions for people who are using where they far more informal. And everything and services there, and you're right, Matt's Cafe and quite a number of places around town. But it would be great to have things in the night and stuff. I agree, and I think that's what this Drugs Commission has been looking at, really, of you know, are we very much based on a 9 to 5 system, Monday to Friday, you know, or do we need to do more? So just to say that that's what we will be bringing back.
Thank you, Alison. Yeah, but I'm glad we're looking at it anyway. I just hope
Yeah.
that something concrete develops from it, you know?
Yeah.
Okay, thank you, Chair.
Thank you, Al. Right, the dates. I was going to look at them, wasn't I? I haven't got them here. Email. Right, so the dates that have been set in the diary are 21st of July, 8th of September, 13th
Are we not
of...
doing August?
No, we never do August, Al.
Okay.
There's no
okay.
meetings in August. 13th of October, 24th of November, the 12th of Jan, 26, 23rd of Feb, 26, and the 30th of March, 26. So for the first meeting, maybe if we could get something in the work plan, probably we do work 3 months planning. So any suggestions?
I wondered if because we've got a draft direct payments document, whether it would be a first draft. So it may be something we bring and then bring back again, maybe later.
Yeah. Right, thank you. That's one. Anything else for 21st of July?
What did we look at?
Alison?
Yeah. Oh, which Alison?
Oh, Alison Anthony.
Oh, yeah.
Councillor Alison. Al, where are we with the volunteering policy? Have we got anything to bring back on that today?
I think that we could perhaps bring something. When's this for now? July?
Or even
Yeah.
well,
There'd be
September then.
definitely some of the poverty things that could come now.
Right.
Sorry, I got a doorbell going the same time.
Oh.
But yeah. Jimmy, let me I tell you what, the other Alison, if I'll speak to Anthony Richards and then shall we come back to you and put some things on for the July one, Chair? Yeah.
Yes, please, but as soon as possible, Al, if you know.
Yeah, no, I'll do that.
Because of the time limit. Right, thank you,
email
Al.
him now, and then
I think that's right. Thank you, Al. That's enough for July, really. Then we've got September, the 8th of September.
Could we put the early help, adult services early help report on there, please?
Early help. Any other items to be added to September?
I could bring when I'm ready.
When I'm ready. Thank you. Do we want to look at October or shall we take the 2 months because July, August, September, we got 4 months, haven't we?
Joe, would it be helpful if we conferred, because Jane's back in work on Wednesday, and we can come back with the full list then, covering all of the items with dates, suggested dates for that, if that helps.
Yeah,
that would be great. Yeah.
Okay, so you feed into Ali? Sorry, Al, I will call you Ali. So obviously, the meeting dates are in front of me. So the next meeting is on 21st of July. Are we okay with the 4 p.m. slot
Chair,
on a Monday?
I think Alan has his hand up again. Sorry, Chair.
Alan?
Yeah, just following on to the request for September, I wonder, would it be possible for us to have a look at or review the document that Alison mentioned a little earlier regarding the outcome from the substance abuse. Perhaps it might be ready then that
I don't think it's ready quite, Al, is it? No, it's not ready.
It's not ready yet. It's got to go to the PSB and everything first.
all right. Okay.
Okay, thanks.
There is a date set for them, but I think we're a little way off yet. We'll finalise it now in a list for you.
Okay, thanks, Al. Right, so are we okay for the 4 p.m. time slot? Yeah?
Yeah.
Yeah, there we are, Al. That's okay. Done. So the next meeting is on 21st of July at 4 p.m. And on that first meeting, we'll have the draft for direct payments, and Alison will bring some items for the poverty agenda. So that's it. Anybody else wishing to contribute? No.
No.
That's it. Thank you for your time, and I'll see you on the 21st of July. Thank you. Take
Thank you,
care,
Chair.
all.
Thank
Thanks,
Thank you,
everyone.
Chair.
Ta.
Bye.
Bye, all.